Welcome to today's presentation. And today's presentation is talking with young people for out-of-home care providers in the context of the COVID-19 virus. And we've already delivered Module 1. Today's Module 2 has a focus on intersectionality and additional considerations in working with young people. So the Centre for Excellence in Child and Family Welfare acknowledges the traditional custodians of the land on which we work and live and recognises their continued connection to land, water and community. And the Centre pays our respects to Aboriginal and Torres Strait Islanders elders, past, present and emerging. And as well as acknowledging our Aboriginal and Torres Strait Islander communities, I'd also like to start the presentation today by acknowledging our participants. So acknowledging carers, you. Even after doing the last module, I started to think about the role of carers during the coronavirus crisis, and it just made me really reflect on how important the work of carers is across the board. It's often undervalued work, but in the context of the COVID-19 and the government regulations, social distancing, lack of access to support, it's more important than ever to acknowledge that you do so much important work and to recognise both that you're dealing with the impacts of COVID-19 on young people, but in turn there are also impacts of the COVID-19 virus on yourselves as individuals and of course in relation to your role in out-of-home care. So just wanted to start with that acknowledgement. Just some housekeeping. So I'm really delighted to be working with Oliver Savaris from the Centre for Excellence. He is moderating the session and which is fantastic for both of us. We're fairly new to using Zoom as a way of teaching and learning. So hopefully everything will go well. But if there are some little glitches, please bear with us. We're just learning as well. At any time during the webinar, you can ask questions through the chat function. So there's a little chat button or through Q&A. But we will be addressing the questions and the answers to the questions or the Q&A at the end of the presentation. So just to make sure that it flows well, we'll just leave those responses till the end. There are going to be 4 polls during the session. Just to let you know, the answers to the polls are absolutely anonymous. And the polls are being asked really to get a sense of where you are at in terms of your understanding, your thinking, what's important to you. So we're going to do the polls. You'll actually see the results of the polls and then we'll have a little discussion around those results. Also, just to say that the information that you receive today is just a guide. So I have worked in health, but I am not a doctor, I'm not a nurse. So it's really important if you're wanting current health and medical information and advice in relation to the COVID-19 virus, there are some links at the end of the presentation. So it's really important to actually look at the Australian government websites or any of the other links to really get a sense of understanding the virus, its impacts and the government regulations. So I need to introduce myself. So my name's Jo Howard. I've worked for the Centre for Excellence for a number of years now. I've also worked across many sectors: family violence, child, youth and family services, drug and alcohol services, youth mental health, family violence. I've been around for a while. So I have got a good understanding, I hope, of out-of-home care, having worked mainly with kinship care, a little bit with resi care. So I hope you enjoy the session. I really hope that it meets your needs and gives you some support. So let's get into it. Okay, so There are 4 modules in this series, and each module exists as a module in its own right, but together the 4 modules provide a comprehensive overview in terms of supporting out-of-home carers in relation to the COVID-19 virus. So if you've missed module 1, that is now on the Centre for Excellence website. You can have a look. But participating in all 4 modules will give a much more comprehensive and thorough overview and understanding of the context for out-of-home care in relation to the COVID-19 virus. So the first module that we had on Tuesday was focused on how young people may be impacted by COVID-19. Today's modules are focused on intersectionality and additional considerations in working with young people. Module 3 is responding to behaviours of concern. So the next module will focus on things like absconding, for example, which participants in Tuesday's module identified as an issue of concern. And the final module, module 4, will be talking with young people about family and community, trauma, suicidality and hope. Okay, so the following presentation is the second of the 4 modules, and each module provides guidance and suggestions for carers of children and young people between the ages of 10 to 18 years in out-of-home care during a crisis. And as I said before, there's a whole list of resources and references at the end of the presentation if you're wanting further information or clarification. So today's module, intersectionality and additional considerations in working with young people. So the learning outcomes for today is why an understanding of intersectionality is important in talking with young people. We're going to explore the differing lens that young people from some diverse backgrounds may have in relation to the virus. And we're also going to focus on how to best support and respond appropriately to young people's diversity. Okay, so we're going to start with a little bit of a poll. So Oliver's going to put the poll up, and once that goes up, there'll be some questions. We'll really just give you a minute to answer those questions. It's not an exam, it's just to really get a sense of people's understanding of intersectionality. Okay, over to Oliver. Great, so thanks. So the majority of people responded with the correct definition of intersectionality, which is that it's a complex and cumulative way that the effects of different forms of discrimination, such as racism, sexism and classism, combine, overlap and intersect. So we're going to spend probably about 10 minutes speaking about this, and then we are actually going to go on and look at young people in out-of-home care and exploring intersectionality, and particularly intersectionality in this time of the COVID-19 virus. The other examples are examples of what we might note if we have an intersectionality lens. So particularly the Victorian government is much more aware than ever before in looking at the role of community services and looking at how government can support community services to have an intersectionality lens. So the person that responded to the first answer is right in a way in terms of an example of how government are paying more attention to intersectionality. We also know the second point, transgender people's experience in education. So that would have been an example of the discrimination that transgender young people may face because they are transgender. And the last one, discrimination against women, is also another example if we're looking at an intersectionality lens. So thank you. I'll go back to the PowerPoint now. Okay, so In terms of what is intersectionality, some of the language can maybe seem new or a little bit complex. But in a nutshell, it's really about recognising that every person is an individual in their own right, even if they're part of a group. So you might be a woman, but it doesn't mean that all women are the same. Or you might be an Aboriginal person, but it doesn't mean all Aboriginal people are the same. You might be gay. It doesn't mean that all gay people are the same. So it's recognising that within a particular characteristic, there are also other characteristics. So, for example, a woman might be lesbian, Muslim, and financially disadvantaged. So with every one of those characteristics, there are forms of discrimination an individual may experience. And those forms of discrimination are not just about one part of their characteristics, they're actually about multiple levels of discrimination. Okay, so that's why the response that people mainly tick, that it's complex because there's multiple levels, and it's cumulative, that you just don't experience discrimination, for example, because you're a woman. It's cumulative because it may also be about being lesbian, being Muslim, and being financially disadvantaged. So all of these forms, such as racism, sexism, classism, combine and overlap and intersect. Okay, so intersectionality also means that it is so important that we look at our own attitudes and our own biases, our own assumptions about people, because if we don't do that, if we don't have that reflection, we can easily fall into the trap of being discriminatory against people, even though we may not mean to. And a lot of the attitudes that we have been formed through our family, through our community, so through our early life. And, you know, often these can be things like racism, even making assumptions, for example, about Muslim people, or making assumptions about transgender people. So an intersectionality lens means that we really look at these assumptions and we think about our own assumptions and start to examine them and challenge them. And it's particularly about building cultural awareness, about recognising differences, recognising diversity, and really privileging that. Okay, so being responsive to difference and diversity. I hope that makes sense. Okay, so Oliver's going to put on a little video, a little DVD about intersectionality, which is where there's a really good explanation. Some of the terms, again, might be a bit technical, but it's a great little video for explaining intersectionality. So again, I'll pass over to Oliver.
What is intersectionality? Intersectionality is a way of understanding social relations by examining intersecting forms of discrimination. This means acknowledging that social systems are complicated and that many forms of oppression, like racism, sexism, and ageism, might be present and active at the same time in a person's life. Everyday approaches to building equality tend to focus on one type of discrimination, for instance sexism, and then work to address only that specific concern. But while the career of a young, white and able-bodied woman might improve with gender equality protections, an older, black, disabled lesbian may continue to be hampered by racism, ageism, ableism and homophobia in the workplace. Intersectionality is about understanding and addressing all potential roadblocks to an individual or group's well-being. But it's not as simple as just adding up oppressions and addressing each one individually. Racism, sexism and ableism exist on their own, but when combined, they compound and transform the experience of oppression. Intersectionality acknowledges that unique oppressions exist, but is also dedicated to understanding how they change in combination. The roots of intersectionality lie within the Black feminist movement, with legal scholar Kimberly Crenshaw originating the term. Crenshaw felt that anti-racist and feminist movements were both overlooking the unique challenges faced by black women. She stated that legislation about race is framed to protect black men, and legislation about sexism is understood to protect white women. So simply combining racism and sexism together does not therefore protect black women. Intersectional theory is now applied across a range of social divisions and also to understandings of domination, such as those associated with whiteness, masculinity, and heterosexuality. Intersectionality is not only about multiple identities, and it's not a simple answer to solving problems around equality and diversity. It is, however, an essential framework as we truly engage with issues around privilege and power and work to bring them into the open. Intersectionality means listening to others, examining our own privileges, and asking questions about who may be excluded or adversely affected by our work. As importantly, it means taking measurable action to invite, include, and centre the voices and work of marginalised individuals.
And I think, if I was thinking about young people in out-of-home care, which is what we're going to focus on now, and applying that lens of intersectionality, you may be supporting an Aboriginal young person. So that would be one lens, one identity or characteristic that you're considering. That young person may be female, so you're also looking at that characteristic and identity as a woman. They may be lesbian, so you're thinking about sexuality, sexual preference, and that's another lens. And they may have a disability. So in that kind of context, you'd actually be looking at 4 potential means of discrimination and prejudice, but you would also be thinking about the needs of that young person through those different lenses and their different life experience and their different ways, I guess, that we might need to consider to give them the best support we can. So that's what we're going to move into now. So just to really reiterate, not all young people we support have the same characteristics. There will be differences in gender, gender identity, culture, ethnicity, ability, sexual orientation, and religion, for example. We could go on, there's a lot. So intersectional theory that we've just looked at asserts that people are often disadvantaged by multiple sources of oppression: their race, class, gender, identity, social orientation, religion, and other identity markers. And intersectionality means having awareness that these characteristics often overlap, which means discrimination and disadvantage can be experienced at multiple levels. So at a personal level and at a structural or systemic level. So, for example, at a personal level, a young person might experience, for example, racist jokes or comments. They may be discriminated against if they, say, go shopping and other people are served first, or they may be discriminated against because someone assumes they're straight when they're gay. So those are some of the examples of personal discrimination. And of course, we know that just being a young person can lead to various forms of discrimination and disadvantage as well. And we also know that for being a young person in out-of-home care can also bring with it disadvantage and discrimination. So in the general public, amongst the general public, in the external world, there can be pejorative attitudes or beliefs about young people who have been in out-of-home care. So I'm just going to remind you before we go on that there is the chat and the Q&A function, because this, you may want to make some comments or you may want to ask questions. And as I said, at the end of the presentation, we'll go to these. But just talking about intersectionality may raise some questions for you. And it would be great if people also want to share comments. It may be about something you've noticed in relation to intersectionality. So, as I just said, young people may face discrimination. For example, they may have less access to information, particularly accurate factual information, less access to services, and feel marginalised because of their age. And young people with specific characteristics may experience additional discrimination, such as reduced access to services, including health services. They may feel powerless, oppressed, marginalised and discriminated against, and they also might feel anxious and fearful about how they will be treated. So we need to be mindful of how we speak to young people. And this we talked about before, about examining our own attitudes and values and how we might mirror some of the values and attitudes that inadvertently support discrimination. Okay, so I guess, yeah, in thinking about some of the attitudes and values we have, where we can stereotype young people with similar characteristics. An example might be if we're supporting a young woman who identifies as a lesbian, we might assume through our own lack of awareness, or because we aren't speaking to that young lesbian woman, that she doesn't need information around sexual and reproductive health. And that actually is evidence-based. We know that medical professionals actually don't talk about sexual and reproductive health issues, for example, STIs, with young lesbian women to the extent that they do with young heterosexual women. So they're making assumptions it's not as important. But we in fact know that reproductive health, sexual and reproductive health, is just as important for young lesbian women as it is for heterosexual women. So that might be an example. Other examples may be making assumptions that someone from a particular cultural background is at a greater or lesser risk of transmitting the virus. So we've seen examples, sadly, in Australia already where adult Asian people have been discriminated against. There have actually been racial vilification because they have been blamed for bringing the virus to Australia or for transmitting the virus. Okay, so obviously as carers, we want to make sure that the young people we work with have the best life opportunities. And in the context of the COVID-19 virus, we want to make sure they're safe and protected, and that they behave in accordance with the regulations to protect our communities. So what we're going to do now is move on to look at the characteristics, the identities of young people in care, and to consider things about risk of catching the virus, transmitting the virus, and breaking the law. Okay, so let's move on. So we're going to go to another poll just to get a sense of where you are at. And the poll is, what examples have you been aware of, if any, in relation to discrimination of young people that incorporate the notion of intersectionality? So we're just going to do a bit of a poll to see if you've actually noticed anything. So I'm handing over to Oliver to put that poll up. Okay, so I do find the polling is really interesting just because it gives, obviously gives examples of the experience that you are having in supporting young people. And it's a shame we can't have more of a verbal conversation about this. But the first answer, so I mean, it's pretty devastating really that a third of you have noted that young people, it's assumed that they're heterosexual. And we know from a lot of the evidence and research on LGBTIQA plus young people that assumption is made quite frequently. And of course, if that assumption is made about a young person, then they are not going to get the most appropriate information and access to services that recognises their identity. So that's a really, it's a really prevalent example. I've already spoken about, we know, and it's been covered in the media, social media, that Asian people are being blamed for causing the virus. 30% of you actually highlighted that young Asian people are being blamed, which of course is absolutely false, and it is a form of discrimination. Verbal abuse of a Muslim young woman. We have 2 people who've disclosed that. Again, it's really disappointing and shocking that that occurs. And not gaining access to timely health care. 5 people, or about a fifth of you, noted that. And again, we know that that is often the case for young people, that because they're young, maybe they're not able to be articulate, maybe they don't have the language to be able to talk about their healthcare needs. And then if we have those other layers, for example, that they're LGBTIQA+, or that they're from a particular cultural background, they're Aboriginal, they're Muslim, those characteristics and identities are going to possibly compound their level of discrimination. The people that wrote other, it would be good if you could put in chat what you wrote, and then at the end we can just touch base with your responses as well. Okay, so thanks, and let's just, excuse me, go back to our presentation. Okay, so intersectionality, we obviously know that acknowledging intersectionality and how young people's experience of the world is shaped is important in order to provide the best response. So this means we need to consider what it means to be an Aboriginal young person. If a young person has a CALD background, if a young person has physical challenges, or if they're a Muslim young person, and how these characteristics may play a role in young people's experience of COVID-19. So that's what we're going to go to now. So we're going to start off by looking at the experience of Aboriginal and Torres Strait Islander young people in care. And we're going to go back just to look at another poll. And of course, we know that for Aboriginal people across the board, including young people, there have been significant and cumulative and ongoing forms of discrimination through colonisation, dispossession of land. We have the stolen generations, and there's ongoing racism and stereotypes. So we're going to go back to Oliver to put up a poll. And if people can just respond to this poll in terms of what you've noticed. Thanks. So you can all see those poll results. So over a quarter of young people have experienced racial discrimination in relation to healthcare. And again, we know, there's so many assumptions that we could talk about in terms of Aboriginal and Torres Strait Islander young people. So one of the assumptions is also about assuming an Aboriginal young person may be a non-Aboriginal young person. So one of the things that we really stress in working with any young person is actually around asking a question around cultural identity is so important. If we don't ask that question, we make assumptions about how someone might look. We actually miss those opportunities to respond respectfully and appropriately to each young person as an individual in their own right. So that can be one way that young people, Aboriginal young people, Torres Strait Islander young people face discrimination in relation to healthcare, but there are also so much racial discrimination just because someone identifies as Aboriginal and Torres Strait Islander people. It's also disappointing that over a third of people are noted making assumptions about Aboriginal and Torres Strait Islander young people being at a higher risk of transmitting the virus. So of course there's absolutely no evidence at all that this is true. And we are going to talk about Aboriginal and Torres Strait Islander young people in a minute, and we're actually going to unpack that assumption a bit more, so I won't do that now. And over a third of you have also noted racial abuse, which is just incredibly sad, inappropriate, and just dreadful for anybody and any Aboriginal and Torres Strait Islander young people to experience that. So thank you for sharing, and we'll go back to our presentation. Okay. So let's look at Aboriginal young people. And Aboriginal young people, or Aboriginal and Torres Strait Islander young people, may have specific concerns about the virus. In a minute, we're going to look at a little video that explores this. But in terms of the previous poll where people identified that ATSI young people may face discrimination in terms of being blamed for transmitting the virus, as I said, there's no evidence that is the case, but we do know that Aboriginal families may live in larger households. So it's culturally appropriate for different generations to live together. The more people that live in any particular household, obviously the risks of transmission are higher just because it's a numbers game, nothing to do with culture at all. Sometimes there can be overcrowding in Aboriginal households. We know adequate and appropriate housing for Aboriginal and Torres Strait Islander people is a real issue. It's a social justice issue. But if there's only access, for example, to one bathroom, there may be less access to good hygiene, and also a higher risk that one generation can infect another generation, and particularly if there's older people living in that household. And we also know that Aboriginal people are more impacted by financial hardship. So that may also mean that they lack the funds, for example, to purchase hand sanitizer or masks. So that can also be a factor in making them more vulnerable to the virus. For young people living in care, they will be aware that Aboriginal people in general have a lower life expectancy than non-Aboriginal people, and they may also be aware that Aboriginal people in general have more complicated and chronic health issues than non-Aboriginal people. And of course, we know that that's a result of the ongoing impacts of colonisation and racism. It's nothing to do with being Aboriginal, but it means that they may be more susceptible to the virus because of environmental and existing health issues. So this can cause Aboriginal young people in care greater concern or anxiety about family and community. Okay, so knowing that can lead to increased concern, increased anxiety. They may be concerned that Aboriginal family and community members that may get infected by the virus may not get access to the right health response at the right time. And already in the polls, people identified that access to non-discriminatory, appropriate and accessible healthcare is an issue for Aboriginal young people and Aboriginal people in general. Aboriginal young people in care may also be concerned about the impacts of racism and discrimination on family and community members who are infected, and they may be concerned about the impact of unemployment and illness on family and community. For example, they may be concerned about whether family can get access to the Centrelink benefits. Can they apply? Do they know how to use the internet? Particularly where we're looking at Aboriginal young people where families and community are living in regional and remote areas. So they're just some of the concerns that may be present for Aboriginal young people in out-of-home care. I'm going to cross again to Oliver. We're just going to look at another little YouTube clip that focuses on Aboriginal people in the context of the virus.
Hi, I'm Tom Kelmer. I'm Koongarrikan on my mother's side and Iwudja on my father's side, coming from just outside of Darwin. My current role is the National Coordinator for Tackling Indigenous Smoking, but I've been working in the health sector for quite a long while. And you might even remember, as Social Justice Commissioner, I put out the first report that talked about closing the gap and the gap in health, and how do we get good health for us as Aboriginal and Torres Strait Islander people. Now, you've seen a lot of messaging coming out about coronavirus, about COVID-19. So I just wanted to give you a couple of hints from my side. The first one, and most importantly, is on hygiene. And what's really important is that wherever possible, we should regularly wash our hands with soap, wash them very thoroughly, sing a song if you've got a song to sing, but really wash your hands hard and use soap, and then put them away. The other important one is when we're coughing or sneezing, or if we see somebody else that are coughing and sneezing, what we're going to do is to tell them, don't just cough, put your hand, your face into your elbow and cough or sneeze that way. And if you have to, try not to use a hanky, but that's okay if you use a hanky, but make sure you wash it really thoroughly. But use tissues wherever you can. Use paper that you can blow your nose in, but then make sure you put that in the bin, or if there's a fire handy, throw it in the fire. Kill those germs before they spread. What's also really important is that you try not to go and put your hands in your face and around your mouth or your nose or your eyes, because that's the way that the virus gets in and can affect us. We are the longest continuing surviving culture in the world. We are Aboriginal and Torres Strait Islander people from Australia, so it's really important that we look after our health as we do. Make sure that we do our exercise if we can. We can't go walking around everywhere because many of us are in isolation, but we should try and do some exercise in the house. But the main thing is hygiene, 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 and making sure it's all good. The other important message is that if you've got sanitizer, that hand stuff that you can get, the antibacterial sanitizer or the wipes, if you got them, then make sure that the phone, you wipe that down, your keyboard, the door handles, you try and keep them really clean. If not, use warm soapy water, but don't use warm soapy water on your phone. Just on the doors and other surfaces. That's the best way to go. The other important thing is that what we have to do is to make sure that we take notice of not moving around. And particularly with Easter coming up, we've got to make sure that we don't go travelling, going and hanging around and celebrating over this time. We have to really be strong and stay in our houses and make sure that we do stay isolated, stay away from infected people. That way we can be strong, we won't get affected, and that all of us, if we all practice this, there's a better chance that we will see the virus not impact on us, and particularly us as Aboriginal and Torres Strait Islander people. So stay fit, stay healthy, good hygiene practices, cough and sneeze into your elbow. That's the way we're all going to fight coronavirus together.
Seeing that little video reminds me that we know the best way to get health messages across to young people is when it's delivered by someone that the young person culturally identifies with, whether it be culture as in LGBTIQA culture, whether it be Aboriginal culture, whether it be called culture. So you might want to consider that little DVD. If you have Aboriginal and Torres Strait Islander young people in your care, it might be something that would be useful to show them in terms of getting the messages across. Okay, so in terms of young people from culturally and linguistically diverse or cold backgrounds, there are some specific concerns that they may have, and specifically in relation to concerns for family and community living in Australia and also in other countries. So young people from cold backgrounds may be concerned they may be blamed or discriminated against because of their race, culture or ethnicity. And I've already spoken about Chinese people being abused, given that the virus originated in China. So young people, particularly those of an Asian background or a Chinese background, may have specific concerns. They may also be concerned that family and community members who are infected may not get access to the right healthcare at the right time, and particularly where they may have family and community that don't have residency status. So we know, for example, that the federal government's economic packages don't relate to people, for example, that have been casually employed under a year. So many newly arrived migrants fall into that category. We also know that where called people have come to Australia on a visa or they don't have full residency status, that they may not get the same access to adequate and appropriate healthcare. So young people might be concerned about the impacts of racism and discrimination on family and community members who are infected by the virus as well. They may also be concerned about the financial situation of family and community, and also about unemployment and community members' access to government support such as Centrelink. So these are just some of the specific concerns that young people from called backgrounds may have about others. And of course, those kinds of concerns they may also have about themselves, particularly relating to discrimination. Okay, let's look at LGBTIQA plus young people. Discrimination is going to be a significant concern for this particular cohort. We already know that young LGBTIQA plus young people are highly represented in suicide rates. And that's even more exacerbated where young LGBTIQA plus young people live in regional or remote areas where they're less likely to be able to access support and less likely to be able to be supported by, for example, peers. So it's very important to be mindful of the mental health of this particular cohort during this time of coronavirus, both because of discrimination, but both because of social isolation. And a lot of health professionals have predicted that the suicide rate may go up as a result of the impacts of the coronavirus. And this cohort of young people will be particularly at risk. And we're going to talk about suicidality and self-harm later on. They may also worry they'll be blamed for spreading the virus and not taking adequate precautions to prevent its transmission. And of course, we saw with the HIV virus many years ago now that homophobia really flourished in the context of that virus. So young people may be aware of what happened back then and really concerned about whether homophobia will increase or emerge because of the coronavirus. They may be worried that they'll be judged, misunderstood, stereotyped, or not receive the best care because of their sexual identity. They may be worried that they'll be unable to receive and maintain the support they get in relation to gender and sexuality. For example, some young people will be involved in peer support programs, which are face-to-face peer support programs, where maybe they meet as a group every week. That is a real source of support for young people, again, particularly in regional and remote areas. Now, that can't happen because of the coronavirus. So again, for that group, it'll be really important to think about how you use social media and different platforms on the internet so that young people that are LGBTIQA plus can maintain their social connection with their peers and gain that level of support. They may also worry that their rights might be undermined. So their choices and their decisions may be taken away from them because of the virus and because of the current government legislation. So they're all considerations there. In terms of young people with a disability, one of the key issues I imagine that you're also grappling with is how young people with a disability are able to maintain their access to therapeutic supports. So some of them will have actually physical delivery of therapeutic supports, and it'll be a real challenge to make sure that they can maintain those supports in the context of coronavirus and with physical and social distancing. You may also need to consider how these group of young people understand and deal with government regulations. So for example, I'm thinking of a young person with a cognitive disability, how you're going to communicate with them, what they need to do in terms of complying with government regulations. So how do you explain social distancing to some young persons that maybe don't have a high level of cognitive capacity to understand that terminology, to understand what's expected and to understand what will happen if they breach those regulations. The other thing will be learning. So how do young people with a disability have access to learning and education, and particularly in relation to homeschooling supports? Okay, I know that one of the other things that's been highlighted is the lack of Auslan interpreters, so particularly in the context of coronavirus. And again, social media may be really helpful in enhancing the young people with a disability and communication issues capacity to communicate with others as well. Okay, we're going to spend a little bit of time talking about a cohort, which is young people with mental health and alcohol and other drug issues, because many of the young people in your care will fit into these categories. So young people with mental health and AOD issues may worry they will be judged and misunderstood. And we know that young people with AOD issues that are already using substances may experience a high level of anxiety and stress because of the virus, because of the government regulations. They may be more concerned about how they're going to get access to the substances they use because of the regulations. So even though we don't want young people in out-of-home care to use substances, the reality is they do. And they need to access these substances through absconding or through being outside of their current care environment. So their concern may be, how am I going to be able to access the substance I use? Which may actually also put them more at risk of breaching government regulations. It can also put them more at risk of using more than they normally would in an attempt to allay their anxiety or concern or boredom. And they may also be more at risk of trying different substances because they can't get access to the substances that they usually use. So we're going to talk about that a little bit more in a sec. They may also fear that existing treatments and medications they receive, both in relation to their mental health issues or their AOD issues, may be compromised, and particularly if they're diagnosed with COVID-19. So it will be important to really reassure them that even if they get sick, that everything will be done as much as possible to make sure that their existing supports and their existing treatment in relation to mental health and AOD will continue, so it won't be compromised. And fear of catching the virus may be compounded, particularly for young people with mental health issues. So they may experience, for example, greater anxiety than young people that don't have mental health issues. And we know that one of the most common high prevalence mental health issues is anxiety and depression. And we know that one of the byproducts of the COVID-19 virus across the board is an increase in anxiety and depression. So that will be something for carers to be really mindful of. We also know that young people with mental health issues, particularly psychosis and delusions, and even more so if they're also substance using, may be more likely to kind of buy into some of the rumours or conspiracy theories that are circulating. So obviously delusions and psychosis can make people think, you know, for example, the virus is a plot from Russia to wipe out a particular cohort of people, or to kill everyone in Australia, or to take over the world. So there are lots and lots of conspiracy theories that are circulating. So one of the important roles for carers is to create a space, I guess, for young people to air their thoughts about the virus and how it started, and also to give really timely and evidence-based information about what we know. So to be able to say, scientists have told us, epidemiologists have told us, the World Health Organization has told us that the virus originated from the wet markets in Hubei province, China, and to really dispel any of those other conspiracy theories. So if you want more information on that, the first module that we had on Tuesday actually talks about the right responses that we can give to young people that help to dispel these myths. All right, let's look at the results of the poll. So half of you indicated that you're concerned about exacerbation of existing mental health issues. So what I was just talking about probably resonated with you. And really just to reiterate that it makes sense. We've got young people in care that have already have mental health issues, and now particularly I think the government regulations about actually remaining in the home that preclude physical contact with people that might support them, and also meaning that they have to comply with government regulations, and the whole context of the virus. I think, you know, it's making everyone feel a little bit anxious. So it doesn't surprise me that people have noted exacerbating of existing mental health issues. A few of you have also concerns about greater risk of being infected. And it just, for me, really reinforces that the more that we can make sure that our young people in care are aware of the hygiene requirements, so in terms of not being infected, the more that we can reduce that fear that they will be infected. So that message that if you really practice good hygiene, you are absolutely reducing the risk of being infected is a really good one. I think the other one for me is also about if you're a carer and you've got a number of young people that you're caring for, how do you actually practice social distancing when you're all in the one house? That obviously is a challenge, and maybe that's part of the reason that young people, some young people have that greater fear of being infected. Not complying with medication we have, not having access to healthcare. We're going to talk about absconding in a minute, and also we're going to talk about using in risky situations in a minute. So, and there are a few, and we've also got using more. One person noted that as well. So we're going to probably look at all of those in the next few minutes. So thanks to everyone for filling in that poll. That's the last poll that we have for today. So in terms of alcohol and other drug, we're going to have a little think about harm minimisation, because it's something that you can consider as a carer in the context of the COVID-19 virus. So harm minimisation or harm reduction is a conceptual framework and a set of practices that focuses on the minimisation of physical, social and legal harms that young people do to themselves and to society as a whole. And I think it's important to note that in the context of the COVID-19 virus, as carers, you're both looking after the young person, their own health, safety and well-being, and you're also being mindful of community health, safety and well-being, and particularly if young people are absconding. So 2 examples of harm minimisation, I'm sure most people are familiar with this concept, would be needle exchanges. So it's actually about providing safe injecting equipment in order to reduce the spread of diseases like hepatitis C. And pill testing is another example where if young people are taking pills, for example, at concerts, pill testing can actually give them advice about the ingredients in those pills so that young people can make an informed decision about whether they want to take them or not. So I'm not talking about these 2 examples that you should do this or that they apply to young people in out-of-home care, but they're just examples of community and social approaches to harm minimisation. So harm minimisation is really about a health strategy rather than a legal or a justice strategy, such as charging young people who use drugs. Okay, so in the context of the COVID-19 virus, a harm minimisation would include things like ensuring that young people are really clear about how the virus is transmitted. And again, we talked about that in Module 1. And particularly through the surface-to-surface transmission of the virus. So most young people will be aware of the coughing, the sneezing, the respiratory droplets being transferred through breathing. They're not as aware of the surface-to-surface transmission. And this is particularly important in the AOD context because, of course, if young people are absconding and drug using, they are going to receive packets which contain the substances. So that will put them at risk because if the virus is actually on those packets, it'll transfer to the young person's hands. If the young person touches their nose or mouth, the virus can gain entry that way. So again, it's about the importance of hand sanitizer, and when the young person returns home, to make sure that straight away they are washing their hands with soap. So that's a really important consideration when you're caring for young people with AOD issues. Also, the other things are basic things such as talking about using a face mask if they're going outside. Again, even if they're substance using, that whole concept of social distancing. So, and using hand sanitizer before and after they score is important. Again, I know that's easier said than done, particularly social distancing. But again, all you can do is really, really reinforce it's not just about their own health, safety and well-being, it's the health, safety and well-being of others, including the repercussions if they bring the virus back into their accommodation or home. So providing the equipment so that young people can comply. So, and I'm sure you already are doing this, providing hand sanitizer, but also little sachets of hand sanitizer so young people can take them with them, and also face masks. So there's some of the things that may be helpful in terms of supporting young people who have AOD issues and who abscond from care and or both. When we're thinking about working with young people with mental health and AOD issues, we also need to consider speaking to them about the implications of scoring substances. So they may find it really difficult to understand the implications of the pandemic, and they may either minimise the risks, no, this won't happen to me, or exaggerate the risks and consequences. We also know that alcohol and other drug use is counterproductive to good mental health. So information, which I'm sure you already have given them, about the relationship between substance use and good mental health is really important. So when young people have increased anxiety, for example, it's important that they know that if they're also smoking weed or they're using ice or they're drinking, that is actually not going to be helpful in reducing their anxiety. It's actually possibly going to increase it. So to normalise the experience of increased anxiety because of the COVID-19 virus is important. and also to really make sure they have that message that using substances is going to be another way that their anxiety or mental health issues is going to increase. So young people with mental health and AOD issues may be also at increased risk of self-harm and suicidality. And that's actually going to be covered in the Module 4. So just to say now that it's really important about monitoring this risk, especially for already high-risk young people. But we'll go into that more in the Module 4. So again, for young people who use substances that need to score substances may mean that they override regulations in relation to social distancing, social isolation. So it can put the young person and the seller of the substances more at risk through that inadvertent transmission. So again, just to really note and to think about the difficult task you have in trying to minimise that risk. And that's, I guess, the harm minimisation approach. You might not be able to stop them absconding, you might not be able to stop them using, but you have the opportunity to talk to them about how they might do this in a way that reduces the risk of them catching or transmitting the virus. Okay, thanks. Okay, so there's some references here that you may like to see. We're getting to the end of the presentation. We're going to have a look at questions in a minute, but these references are really, particularly really helpful in terms of young people with AOD and mental health issues, but across the board. So that is today's presentation. I hope it's been useful and helpful. I know that it doesn't give all the answers and that's really hard for you, but hopefully it will give some suggestions about how you do this work with young people. I'm going to just open up now to see if anyone has any questions.